Hello, my name is Dominic Storella, and today I will be leading this video on the first aid requirements 4A and 4B for the Tenderfoot rank. Simple cuts and scrapes. What you want to do if you have a simple cut or a scrape is you want to clean it with soap and water or rubbing alcohol. And then you ask the victim if they have any allergies to antibiotics, and if they don't, then you apply antibiotic ointment. And after that, you always want to apply a Band-Aid. Blisters. A good way to prevent a blister is by wearing good shoes or hiking boots. And a good way to detect a blister is with a hot spot, if you feel a hot spot. And if you do, you want to apply moleskin. And if you get a blister, what you want to do is you don't want to pop it. You want to add a piece of moleskin, multiple layers if necessary. And if you have to keep hiking, or you think it's going to pop on its own, then it's probably best to drain the liquid by washing the blister and then pricking it with a sterilized pin. You can sterilize it with a flame. Minor burns or scalds. If you get a burn, you want to run it under cold water. Don't use ice. Ice can actually damage the burn. And you want to apply aloe vera. If you get a sunburn, you want to apply a damp cloth. And always use sunscreen before you go out or before you spend a lot of time in the sun. Bites or stings of insects and ticks. To prevent these, you can just wear long sleeves and long pants, and you can use bug spray. It's very effective. If you get a tick bite, you want to remove it, and you can do that by, you have to wear gloves, and then get tweezers that are clean, of course, and you want to pull the tick out of the skin, and you want to grasp it with the tweezers as close to the mouth as possible. You want to pull it gently without squeezing, twisting, or jerking, because that can cause the mouthpiece to fall off. You pull it gently off, and then once it's out, you can put it in a little plastic container that you can send to your doctor, and the doctor can check if it has any diseases it could have transferred. And then you want to clean the wound, and then sterilize the tweezers with alcohol or a flame, and then wash your hands. Venomous snake bites. If you're with someone who gets a venomous snake bite, you want to keep the victim calm. You want to call 911 or just get to a professional. Then you want to wash the wound. Try to restrict movement of the bite area by wearing a splint. And you want to keep it at, if you get it like on your arm, you want to try to keep it relatively at heart level. You don't want to keep it lower or higher. And you do not use a constricting band or use ice to try to constrict blood flow. And always try to treat for shock and reassure the victim. Nosebleed. If you get a nosebleed, you lean forward, you pinch the bridge of your nose just below the bone, right there, and you want to add a cold compress. You hold for roughly 10 minutes, and then you check, and if it's still bleeding, then you hold for another 15 minutes or so. And if it's still bleeding, then you want to try to seek medical attention. Frostbite. You can detect these if you have numb areas or there are grayish-white patches. You want to try to move the victim to a shelter as soon as possible. And if it's on the ear or the cheek, you want to take off a glove that you have and put your warm palm against the ear or the cheek to try to warm it up. If it's on a hand, you try to put it on the skin and take off clothes if necessary, if you want to put it on the skin. And if you think the frostbite is severe, you want to change into dry clothing or change the victim into dry clothing and get a professional. You don't want to rub the frostbite area. And if you don't think that it's going to refreeze, you put it in warm, not hot, just warm to the touch water until normal color returns. Choking. If you see someone who is choking, they're probably going to do this. This is the universal symbol for choking. They're doing this, there's a 3-step process. First, you ask them if they are choking, and if they say yes, then you don't do anything because they can speak, and they're obviously not choking. But if they're like, they like nod, then you move on to step 2. You ask them if they need help. And if they indicate that they need help, then you move on to step 3. If they don't, then they might pass out, and then you can help them and call 911. And on step 3, this is where the fun part happens. You want to put your arm across the chest and then strike the back between the shoulder blades with your palm. And you want to do that roughly 5 times. And if that doesn't work, then you move on to the Heimlich maneuver, which is when you make a fist, and then you put your palm over it, and then you put it just below the chest, and you want to push in and up. And that way you push all the air out of the lungs. And if you do that a few times and it still doesn't work, then call 911. Alright, requirement 4B. Describe common poisonous or hazardous plants. Identify any that grow in your local area or campsite location. Tell how to treat for exposure to them. Alright, the only one that we have in this area is poison oak. And you can tell it's poison oak because it's got 3 different leaves. Leaves of 3, let it be. And if it's shiny, watch your hiney. Those are the 2 mottos for detecting poison oak. And if you touch poison oak, or if you get poison oak somewhere on you, what you want to do is you want to change your clothes, if it gets on your clothes. And you want to put your clothes in a plastic bag until they get washed. And once you when you wash them, don't wash them along with non-poisoned clothes. But when dealing with the poisoned section of your skin, you want to clean it with rubbing alcohol or dishwashing soap. You want to scrub a lot. You want to use a lot of water. Don't scratch the site. If it's severe or in the eyes or genitals, or the poison was swallowed, you want to call 911. If you got tools that touched the poison, you want to clean them with alcohol, soap, and lots of water. And another good idea if you touch poison oak is you want to take a cold shower, because that will wash all the poison oak off. All right. Thank you.